Following the Civil War and up to the Great Depression, Black Louisvillians did not devote all of their time to combating racial discrimination. They carried on with their daily life and gladly accepted the contentment that came along their way. Most Black Louisvillians understood they would continue to be confined to segregated neighborhoods and excluded from white organizations, so they created several institutions and organizations to fill their community needs. They established their own hospitals, libraries, orphanages, and settlement houses to benefit the community and trigger racial uplift. Public libraries for African Americans were not prevalent in the South until the early 20th century, when they were introduced sporadically. The first 4 African American libraries opened in 1905 and soon became common models for these libraries in the South, one being the Western Colored Branch in Louisville, Kentucky, located at 604 South 10th Street. The Western Branch opened in September of 1905 and operated out of 3 rented rooms within a private home. This concept was not unusual for African American organizations. In 1908, the Western Branch became the milestone organization when it was moved into a Carnegie-funded facility, making it the first African American library in the South in a Carnegie building. This establishment marked an entirely new level of achievement by a new group in American history, the emergence of the Black middle class. One prominent feature of this emerging Black middle class was a collaborative effort to create new, beneficial public facilities for racial uplift. A paramount figure in Louisville's Black middle class worked hard to turn Louisville's African American branches into regional models of racial uplift. This was Reverend Thomas Fountain Blue. Thomas Blue was crucial to the success of the Western Branch. He established the first African American library department in the United States. He created an apprenticeship course for African Americans aspiring to enter into the library field, all while transforming the library into a service place for the community's benefit. To Thomas Blue, education was the most effective means of ensuring racial uplift. The Western Branch provided students with a place to learn, grow, and increase their skills in practical theory, resulting in the racial uplift the community desired. Within its first year, the Western Branch circulated over 95,388 books by adults and 98,632 books by children. The work of this first branch was so successful that on January 28, 1914, a second Carnegie-funded building was erected. This branch became the Eastern Colored Branch in East Louisville. The addition of the second library made Louisville the only southern city to have 2 Carnegie-funded buildings for its African American readers. Some notable programs provided by the library were its annual storytelling contest between the 2 locations, the Social Center Service, which provided a common place for meetings, and the Library Apprenticeship Class, which trained African American libraries from many southern cities. The Western Branch contributed to the public by providing a place for amusement and recreation. It was equipped with a large room suitable for basketball and other indoor games. The children who came to play stayed to read. The library's community center contributed to the professional and social uplift of the Black community in Louisville by providing an acceptable meeting place for teachers, doctors, and others where they could hold conferences and discuss their problems under positive and cultural surroundings. During this time, African Americans also worked hard to establish themselves in the medical field by developing places where Black physicians could treat patients and improve their skills through lectures, workshops, and training sections. African American doctors and patients were excluded from most hospitals, contributing to the poor health status of many in the African American community. Black physicians saw Black hospitals as a mobilizing movement towards racial uplift and an improvement in the social standing of Black society. The Red Cross Hospital in Louisville, Kentucky, was founded in 1899 by a group of African American physicians who felt a need for a place to treat Black patients in a segregated city. The hospital was first located at 6th and Muhammad Ali Boulevard, but was eventually relocated to 1436 South Shelby Street. The Red Cross Hospital was vital because African Americans could not come to white hospitals to be treated. They needed a place to be admitted and treated themselves. In the beginning years, the struggling hospital was supported by civic groups, church groups, and philanthropic-minded citizens who raised funds. The first appointed Black physician was Dr. William B. Settle in 1940 and the first director, Dr. J.B. Bell, in 1941. Under Bell's direction, the hospital received a $16,000 Rosenwald Fund for capital improvements, and the city of Louisville appropriated $5,000 for the appointment of trained laboratory and X-ray technicians. A full medical staff of predominantly African Americans was organized and integrated in 1942. The hospital faced many financial difficulties, but because of segregation and support from local African Americans, the hospital was able to remain open and the predominantly black staff was able to continue successful care. The hospital provided 3 main services to black patients: medicine, surgery, and obstetrics. There were 3 major operating rooms, a cysto room, a minor operating room, and a fracture room. The obstetrical service provided a soundproof labor room, 2 delivery rooms, and 14 obstetrical beds. In 1964, 271 newborns were delivered, including twin and triplet births. The hospital staff examined and treated 2,843 patients. From 1945 to 1965, the hospital experienced a patient increase from 8,737 to 21,611, providing important and necessary care towards the health and welfare of Louisville's African American community. These institutions not only provided necessary services and recreational facilities, they also gave Black Louisvillians a reason to be proud. Since the Civil War, Black Louisville succeeded in producing a strong community that offered several services and activities, all for their general welfare. From the 1920s on, Blacks continued breaking down barriers that many Blacks thought were impossible.